My name is Cindy, and I live in Schenectady, New York, and I'm a 63-year-old female. I was born in New Berlin, New York, put up for adoption when I was 3. The Alliance for Positive Health has been so amazing. I've actually learned to feel more comfortable with my diagnosis. When you're first diagnosed, you go through all the process, denial, grief, and you just don't want to tell anybody. You feel embarrassed, and I did anyway. Since I started coming to the CAM meetings and getting more involved with the Alliance, I'm embracing my diagnosis, and I'm getting more comfortable with it. I was diagnosed April 2009. Unfortunately, I find in the Schenectady area when you're diagnosed, there's no pamphlets, no information where you're going. They just immediately tell you you have to see a doctor, of course. I had a really good friend at work, and he had told me about the Alliance. So when I originally went in, it was to try to get some help with insurance because my policy was costing me a lot of money out of work. Now ADAP helps me with my medical spend down so that I can get the services I need to have that coverage for the Medicare and Medicaid, which is very important.
So the Women's Program is a grant that is based for women of color, but we turn no women away. What I do is I advocate for them at Department of Social Services. We escort them to doctor's appointments. I also help to locate providers. I also escort them to their first appointments if necessary. We assist them with filling out housing applications and gathering the necessary documentations and sending it in for them. Cindy completed our program successfully. She was linked to her providers. She's making all her appointments on her own, and she's just an excellent person to be around. She'll make you smile even when you don't feel like it.
The SELF group is centered for women only who are dealing with HIV, and it's to help us learn how to deal with grief, and when I say grief, it could be somebody you've lost in your life, or it could be the grief you feel when you're diagnosed and you all of a sudden feel like you're somebody different, that you've lost something important.
So there is a benefit for getting tested at the Alliance for Positive Health. If anything does come back positive, you have to remember that you have an amazing team that will support you, and you will be connected to a multitude of services to help you along your way in the next journey of your life.
The Food for Life program, it helps supplement. I only get $58 in food stamps. Healthy food's important to us. We need that produce, we need those fresh vegetables. You just can't do that on $58. So this actually supplements us, gives us healthy food to eat. It shows us things that we can buy to stretch our food out and to make wise choices and just feel better about ourselves.
The medical transportation program, we serve all 17 counties. We do help clients and individuals living with HIV/AIDS. We do have vendors in each of the counties that can help assist transport clients to and from appointments.
And it makes it possible for me to come and participate with some of these programs. I wouldn't be able to get to the Alliance. I live in Schenectady, so to come to Albany, that's 3 to 4 buses for me.
The Alliance for Positive Health has been providing services to people living with HIV/AIDS for over 30 years. The 17th annual Dining Out for Life event supports the Alliance for Positive Health's mission to reduce the impact and incidence of HIV/AIDS. Because of the generosity of our sponsors and donors, we can continue to help our clients and their families who are living with HIV/AIDS or need our services. Join us in supporting our participating restaurants on Thursday, April 30th by ordering takeout delivery or purchasing a gift card. Please support the Alliance for Positive Health's vital programs by making an online donation at allianceforpositivehealth.org.
Dining Out for Life directly supports program services, which the Women's Program is also a part of, and we service women who are HIV positive and high-risk negatives.
Dining Out for Life definitely supports programs like medical transportation with clients living with HIV and AIDS.
Dining Out for Life is really good for the testing program because it can help fund people to get tested for free who may not meet specific grant funding requirements. This will allow us to test anybody who walks through our doors, and we don't have to turn anybody away.
The Alliance for Positive Health helps me, but it helps your community, and it helps people that you don't know really need that help and that support.
Hi, I'm Bill Farragon, Executive Director of the Alliance for Positive Health. I want to thank you for Dining Out for Life.
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 Thank you for dining out for life.